Hello and welcome to Health Affairs This Week. I'm your host, Jeff Byers. We're recording on September 11th, 2025. As a quick reminder, we released a new issue on insights on the opioid crisis. As a note on that, we have a free event, a lunch and learn event on September 17th on the current opioids policy landscape and what's ahead. Josh Sharfstein and Brennan Saloner will lead the discussion. It's free. Please join us. And we have a new date for our September Insider event, which is on prior authorization. It's current state and potential reform. The old date was on September 23rd, but erase that date from your mind because it's now on September 29th. Speakers include Mark Fendrick, Ravi Gupta, Michael Akilah, and Christina Andrews. Today on the show, we are going to talk about the recent happenings at the CDC and through the lens of vaccines. We don't really dive into politics too much in the show. For one, it can be a little tedious to track. And frankly, I'm just not as interested in politics or vaccine politics as I am about policy impacts and the business of healthcare. And second, Health Affairs is a bipartisan organization. But there has been a fair amount of news recently that does have some policy implications. So we're going to highlight what wonks should have on their radar. To do that, I have on the pod today Health Affairs' own Akilah Wise. Akilah, welcome back to the program.
Hi, Jeff. Thank you. I'm so glad to be back.
Yeah. So in late August, former CDC director Susan Monterez was fired. What are the details of that, and what's happened since?
Right. So Susan Monterez was fired as of 2 weeks ago. She was the CDC director. Monterez led the agency for less than a month. She was confirmed in late July, sworn in on July 31st. Her attorneys alleged that in a statement that she was targeted because she refused to approve unscientific and, quote, reckless directives and fire dedicated health experts. So essentially, Monterey clashed with Kennedy over COVID vaccine policy changes. In addition, I want to add that this also comes with more CDC leaders resigning in protest. There were two other top CDC leaders that resigned, I believe, last week, including Dr. Dan Jernigan of the National Center for Emerging and Zoonotic Infectious Disease. So this goes along with the Monterez firing and the way that people, public health leaders, and scientists have been responding to the administration and their stance on seems to be vaccine policies, but other policies coming out of this current administration's HHS.
And just so listeners know, we're building this podcast off of reports that are around. We'll put some links on the show notes. Yeah, so I would say a fair amount, not my words, but I would say that it's probably okay to describe this firing as somewhat controversial, according to some reports. And over 1,000 HHS staffers had something to say about it. Is that right?
Yes. So early last week, current and former HHS employees sent a letter to Kennedy, essentially naming the actions he's taken with the center as well as with other agencies within HHS as endangering the nation's health. This comes with the upheaval of CDC as well as FDA decisions to rescind emergency approvals for the COVID-19 vaccines, as well as other efforts that the administration have made in regards to public health.
Yeah, and I will say that HHS has about 80,000 to 62,000 employees. So depending on that count, that is about a little over 1% of HHS staffers that released this letter calling for Robert F. Kennedy Jr.'s resignation. So honestly, kind of a small amount, but also heard. And it also should be noted that Susan Monterez will testify before the Senate Health Committee next week to give her version of the firing. We talked about the letter. Is there any other details of that letter that you want to go over, Akilah?
In addition to the letter that was released last week, this call also goes along with other calls from organizations, including the American Public Health Association and National Nurses United, calling for Kennedy to resign. And essentially, people are very worried about how evidence based principles are being undermined when it comes to health policy. And so I'm glad you pointed out the numbers of the HHS employees who are included on this letter. And it should be noted that some were anonymous and others were not.
Yeah, it's at like any culture clash that you've seen in organizations over and companies over the years. I was just as we were preparing for this was I immediately think of return to office policies, and while that's not super healthcare related, um, I do think you can see some culture clash of like when some companies want to say like, "Hey, it's time to come back to the office," and then some employees say like, "I don't think so, buddy." A 2024 report on HR Dive just led me to that 1 in 5 workers say they're ignoring return to office rules.
Oh,
Again,
really?
not really healthcare related, but just kind of like goes to show culture clashes of when new administrations or new leadership or high level changes take over.
Sure. Yeah.
Thanks for taking that sidebar journey with me. So a lot of what this culture clash is over, especially with Susan Monterez's ousting, is on vaccines. So there's been a lot of movement on vaccine policy and vaccine recommendations, um, and frankly, it is very confusing. I think it is not a partisan thing to say these recommendations could have gone smoother, and I'll get into a little bit of that as well. But can you, Akilah, just give us the details of like the FDA approved updated boosters, remove some authority use authorization? What are the details of these new guidelines?
FDA recently revoked the broad emergency use authorizations for the COVID vaccine, which were essential to saving lives. During early on in the COVID pandemic and in the subsequent years. So, what this means for now is that adults 65 years and older, they remain eligible. So, people who are between the ages of 5 and 64 years old only qualify if they have an underlying health condition. And so, we understand that now, but for example, heart disease, asthma, or cancer. And also, it should be noted that shots for healthy children under 5 years old are no longer broadly approved. So we have health experts, who argue that these vaccines are still very much important for the general public, especially as risks and severe outcomes resulting from COVID and long COVID remain apparent. In addition, there are states in which um, there's a prescription that's required. I live in one of those states. I'm in Georgia, and I recently tried to get my vaccine in a local CVS and was told by the pharmacist that I would need a prescription unless I went through something like Minute Clinic, in which I would see a medical professional and be able to get the vaccine there. So I think overall, Jeff, this signals a lot of confusion.
Yeah, I would say it's also been confusing. And I'll just quote a headline from NPR from September 6th that concerned about federal vaccine policies, states are crafting their own. And again, that's on NPR. We'll put the link in the show notes. But they mentioned that New York has declared a statewide disaster emergency to preserve access to COVID-19 vaccinations. The state of New Jersey on September 9th released an executive directive or and standing order to ensure access to COVID-19 vaccines in New Jersey. So that's just two examples. We'll put the links in the show notes. But, I live in Virginia, and I believe you need a prescription now to get a COVID-19 vaccination. But, maybe like 5 days ago, CVS was saying you can't get them at all. So that really does create a lot of downstream confusion, even if someone wants to get a COVID-19 vaccination, of like, Akilah, you and I are plugged into the healthcare world, but like, let's say John Q. Public or like Jane Q. Public, who isn't as plugged into healthcare, like they might just hear something like, oh, I don't think I can get that anymore. Or like they might be confused about like if it's even available or if it's affordable anymore. So there's just a lot of confusion that's potentially happening on that. If people want, if for those that actually do want to get the COVID-19 vaccination, and I'll just kind of quickly mention there's a journal article in Health Affairs from November 2021. So it is now almost 4 years old at this point. But it was by Matthew Crane and co-authors, and the headline is "Disparities in County COVID-19 Vaccinations Linked to Disadvantage and Hesitancy," where the main finding is almost kind of the title of the article itself, where counties that score high on both hesitancy and vulnerability are especially likely to have lower COVID-19 vaccination rates compared to the rest of the country. So it is at a county level, but I think it is one data point. So it is an N of one for a journal article. I'm not doing a complete lit review for this podcast, but it is one point of like how different confusions and structural elements can impact particular health outcomes that one is trying to achieve.
When it comes to vaccine hesitancy, what's really important is to have a trustworthy public health agency that can be clear and have clear objectives and messages to the public.
Yeah, and another point, just kind of similar of like how policy impacts behavior. So when you're talking about like potential vaccine hesitancy or people making choices, healthcare choices, if you're a behavioral economist, we would love to have you on the podcast. I would love to talk to you about just how the diffusion of ideas help people make choices. And another article as we were preparing for this episode I looked at from Health Affairs was also the title kind of gives the finding away. Guaranteed cash incentives boosted COVID-19 vaccinations of young adults, evidence from West Virginia. So that's from Yin Wang and colleagues from May 2024. And it just kind of shows like the rich tapestry that goes into making health decisions. And so while we can't say for sure whether these new guidelines how much they'll impact COVID-19 vaccination rates for this upcoming flu season. But I would imagine an entrepreneuring health services researcher probably is thinking about how to study that. And I will also mention that as we mentioned earlier, Susan Monterez will be testifying to the Senate Health Committee next week. And also happening next week, slated for about September 18th or 19th, is the next meeting of the CDC's vaccine panel. So it will be interesting to see what A, comes out of Susan Monterez's testimony, and B, from the Health Committee's vaccine panel. So more to come there. We're not going to wrap it up in this podcast, but it is interesting to note for what health wonks should be paying attention to about how these, even if you find politics boring like I do sometimes, how it actually does make downstream health behavior impacts.
Yeah, thanks, Jeff. I just want to add that, when it comes to vaccination policy, there's a recent report that came out from Stanford University. They looked at the effects of falling vaccination rates across the nation, and they found in Florida a 15% decline in vaccinations against measles over 25 years would lead to 1 million measles cases.
Yeah, and if you are looking for coverage on RFK Jr.'s Senate testimony, I'm sure New York Times got you covered. But one thing I want to mention as we wrap up, we had a recent episode of Health Affairs This Week with Dr. Aaron Carroll, president of Academy Health. And just as a follow-up on that of note, if you should go back and listen to the episode. It's very fascinating to hear insights from Dr. Carroll. But also the Trump administration recently agreed to restore some healthcare pages. So you may recall that some health agency web pages and data sets went dark for a little bit to comply with executive orders. It was announced that they are going to reverse that and put them back into the public sphere. So go listen to that episode. Well, Akilah Wise, thanks for joining us today on Health Affairs This Week. And if you, the listener, enjoyed this episode, send it to a friend and check us out next week. Thanks all.
Thanks.